Welcome back to the show, everyone. Thanks so much again for tuning in. I really do appreciate that. And what I'm going to be doing today is going to be doing a solo podcast on insulin resistance. So insulin resistance is something that a lot of people have been discussing in social media lately. A lot of people, unfortunately, are a little bit confused about it. They don't understand, why it's so important. And also, more importantly, they don't understand how that they can potentially reverse it or at least improve it. And so what I want to do today is have a real fulsome discussion on insulin resistance, but I'm also going to be talking about diabetes as well and some treatments. So let's get into it. So first of all, in order to understand insulin resistance, you have to understand what insulin does. So insulin is a hormone that's going to shuttle glucose into your cells. And so what happens with insulin resistance is that you still have that insulin, but it's just not shuttling that glucose into your cells anymore. And so what you want to do in that situation, obviously, is try to reverse it to get back to normal physiology, because insulin resistance is linked to diabetes, metabolic syndrome, heart disease, almost everything that you can name. So in order to get your body to get into a state where it can use that insulin and put that glucose into the cells, then you need to be in an insulin sensitive state. So you may have heard of insulin resistance before. You may have also heard of insulin sensitivity. So insulin sensitive is when you have insulin that can do its job by essentially getting that glucose into its cells. So what happens, say, when you're a type 2 diabetic is that, and you have insulin resistance, is that you have higher levels of insulin because it's trying to compensate by putting the glucose into the cells. But like I said, because you're insulin resistant at this point, you're not able to get that glucose into the cells. So it's going to try to compensate by increasing overall insulin. And that's why you'll have a higher, say, fasting insulin, which I'm going to talk about a little bit later when I go over some blood work. But I just wanted to give you that kind of core overview as to what insulin resistance is. And again, it's when you can't shuttle glucose into your cells and you have a higher normal than insulin level in your body. And as I said, it's linked to all those horrible diseases, hypertension, cardiovascular disease, vascular aging. There's so many things that insulin resistance is linked to. So you definitely do want to fix it. So let's go over some of the markers. How can you actually measure insulin resistance when you go to your doctor? So maybe the best way where you can measure insulin resistance is going to be your triglyceride to HDL ratio. And so this is on a basic lipid panel. And in Canada, this is actually free, which is great. You do have to fast for this test. So it's really important to fast for this test. So nothing to eat or drink but water for 12 hours before you get this test done. And what you want to have is you want to have a low triglyceride and a high HDL. So, the bar for, having, good insulin sensitivity overall, I think is fairly low when people say 2-to-1, like a 2-to-1 triglyceride to HDL ratio. I really think it should be at least 1-to-1 or maybe even in the opposite direction. So 1 triglyceride to 2 HDL overall. And so that's what, I think you should try to aim for if you're really trying to optimize things, but at least have it at 1-to-1. Because as soon as you go over, that 1-to-1 ratio of triglycerides to HDL, that is going to indicate that you are becoming insulin resistant. And the reason that happens is that one of the functions of insulin is that it's going to stop the lipolysis or the free fatty acids from your fat cells from going into your blood tissue. And so when you have insulin resistance, that no longer gets stopped. And so what happens is those free fatty acids are going to be released from your fat tissue and into your bloodstream. And there's a whole cascade after that I'm not going to get into to bore you with the details. But essentially what happens after that is that you're going to get high triglycerides from these free fatty acids floating around in your red blood cells, and you're going to get a decrease in overall in your HDL, or your high density lipoprotein, which is also known as your good cholesterol, but we all know that it's a little bit more complicated than that. But that is a very, very good test for understanding what your overall insulin sensitivity or insulin resistance is. But you definitely do want to get some, other tests done. Fasting insulin is a really good test to do. Again, obviously, because it's a fasting test, you definitely have to be fasted when you do take this test. It's not something that you can just do on the fly after you've eaten. And then the other test that can go along with this is a fasting glucose. And then from there, you can actually calculate what something is called as your HOMA-IR. And this is also another thing that you can look at when you're trying to figure out what your overall insulin sensitivity is or whether or not you are insulin resistant. So those are sort of the main things that you want to look at on your blood work. So again, it's the triglyceride to HDL ratio, and then you want to get a fasting insulin and then a fasting glucose. And then by using your fasting insulin and your fasting glucose together, you can calculate what's called your HOMA-IR, which is, again, just another test that you can use to help evaluate your overall insulin sensitivity or insulin resistance. And the way that you get your HOMA-IR is by multiplying fasting insulin by fasting glucose. So, both really good tests on their own, but probably even better when you use them together to get that HOMA-IR test done. But in addition to getting those tests done, you also want to look at what your overall blood sugar is. So a fasting sugar is just a snapshot of what's going on, obviously, overall in your system. So the best test to really get a good measurement overall of what's going on with your blood sugar is going to be something called a hemoglobin A1C. And so this is going to measure your blood sugar over a 3-month period. And ironically, actually, I just learned this past week from one of my podcast guests is that in Canada, we actually have a higher threshold for diagnosing prediabetes. So in the States, you want this to be below 5.7. So 5.7 is considered to be pre-diabetic. In Canada, we actually have it at 6.0. But for anyone listening, to this, I really think you should be keeping it, 5.5 or below overall. And that'll kind of keep you, out of that range where you're, getting close to becoming pre-diabetic. And of course, I'm always looking for people to become optimal. So if you can get it down to, somewhere to 5.2 or 5.0, that's going to be better for you overall. So those are sort of the numbers that you should be looking at. Once you get to 6.5, then you are considered to be diabetic. And so, you really want to stay out of that range so that you can make sure that you have really good blood sugar control overall, because it's so important for so many things. Diabetes, it leads to so many complications, which I am going to get into a little bit later. One thing, though, about your hemoglobin A1C is that, as I said, it is a measurement of your blood sugar over 3 months, but people do have a little bit of variability on this. So some people, they have red blood cells that only last like 60 days, and some people have red blood cells that last closer to 120 days. So the way that this test works is that it tests the glycation of your red blood cells. And so when you have a high amount of glycation over the 3-month time, or over a 60-day time or a 120 period day time, you're going to have a higher hemoglobin A1C. But what you may have been assuming now is that if you only have, a red blood cell that works that's in your body for 60 days, then there's going to be less time. And so for those people, they may kind of get a falsely low hemoglobin A1C. And then for people who have 120-day red blood cell, they may get a falsely elevated hemoglobin A1C. So even though it is a really good test overall, sometimes there can be a little bit of mismatch with that. And so I mentioned that because some people may find that they have, a great fasting insulin test, for example, but their hemoglobin A1C is just not that optimal. And so for those people, what you can get tested is something called a fructosamine test. So this is not affected by your red blood cell lifespan. And what this can do is this can test your overall blood sugar over about a 2 to 3 week period. So obviously that does have some limitations because, 2 or 3 weeks is not as good as what we hope to be, the average of 90 days in a hemoglobin A1C, but it can still give you, a little bit of an idea of what's going on with your overall blood sugar control. If you do fall into one of those people that have, likely a longer length of a hemoglobin A1C that's giving you a little bit of a false negative. And so, what I would really look for if you're trying to, determine if you are one of those people is to compare your fasting insulin with your hemoglobin A1C. And if they match up, then great. You're probably right in that 90-day ballpark of people who have red blood cells lasting 90 days. But if you find that your fasting insulin is, low, but your hemoglobin A1C is a little bit high, then you may be one of these people who have 120-day red blood cells, and you may want to get a fructosamine test because that may actually be a little bit more helpful for you for determining whether or not you do have good blood sugar control overall. So those are some of the biomarkers that I wanted to mention. So I am going to move on to something called advanced glycation end products. And so, these are the things that really cause the damage within diabetes and that really cause us to age overall. And so, hemoglobin A1C, when the glycation happens with the red blood cell, that is just a measurement or a biomarker of what's going on overall with our blood sugar. But those are actually reversible reactions. Whereas when you develop what we call them AGEs, ironically, advanced glycation end products, those are going to be irreversible. And so that's when the glycation can happen on collagen. It can happen on elastin. So when it happens on collagen, you can get real stiff connective tissue, stiff arteries. When it happens on elastin, that can lead to like wrinkling in your skin. These places can also happen on like the lenses of your eyes, which is why, a lot of diabetics do have trouble with their eyes as they, if they have, really poor blood sugar control overall. And so, there are some things that you can do, to try to decrease the overall formation of these products. So first of all, you do want to keep your blood sugar control, controlled overall. And I'll get into, some details later on as to how you can certainly do that. But just for now, some other things that you can do in addition to keeping your blood sugar controlled overall is that, by reducing some of the cooking methods, like if you're really charring your foods and that kind of thing and using a lot of high heat, then that can cause more of these AGEs to form. And you do want to have some antioxidant support going on overall because oxidation is part of the process in the formation of AGEs. Of course, people always ask, are there any supplements that can help with this? There are a couple that have been shown to decrease the formation of AGEs. The one that probably has the most evidence is called carnosine. And so that can decrease the glycation overall. And then also benfotiamine. So that's actually a B vitamin that you can get. And so by using these products, you may decrease the formation of AGEs overall, which can really just decrease your formation of, the overall aging process in the body. So now that we got that covered, let's talk a little bit about exercise. So exercise, we know, is one of the best ways to improve your overall blood sugar control. And a lot of people understand that when they exercise, it does increase their insulin sensitivity. And it doesn't matter whether you're doing a weight training workout or whether you're doing a aerobic workout, you are going to increase your insulin sensitivity. Now, a lot of people think that there's this kind of magic 1 to 2 hour window afterwards where your insulin sensitivity is through the roof. It's not what's really been shown in the research overall. Overall, the research shows that your insulin sensitivity actually stays high for about 24 to 48 hours. So, that 1 to 2 hour period may be a little bit of a myth overall, but with regards to muscle contraction, so when you're doing, anaerobic workouts or lifting weights, there is a little bit of, evidence suggesting that from the contraction, you are going to get some increased sensitivity to the muscles that you've used during that period of time. And so what it does is that it brings the GLUT4 transporters to the membrane. And then from there, you're going to get more increase of glucose into the cells. And so, again, there's a little bit of, mechanism there that kind of does make sense with regards to, weight training. And, there is a lot of anecdotal evidence out there. A lot of people talk about this, kind of magical 1 to 2 hour, anabolic window. But, as I said, when you look at a lot of the research, the insulin sensitivity really seems to spike for about 24 to even 48 hours after. So, if you're working out, all the time, then you're basically always going to have, heightened insulin sensitivity, which is obviously, a good thing overall. So we've talked about exercise. Let's talk now a little bit about nutrition and some ways where you can, flatten your glucose curve. So the number one way that where you can really flatten your glucose curve, after you've eaten, a high carbohydrate meal would be to ingest some fiber, particularly something like psyllium husk. And, before I get into that a little bit, obviously, the more carbohydrates that you're going to eat, the higher you're going to have a glucose spike overall, a higher insulin spike as well. So, just eat carbohydrates, within reason. And obviously that's going to be the number one way to manage it overall. But in terms of what you can do to kind of reduce that, as I said, fiber is going to be kind of the main way. It's really going to slow the digestion of your food and overall of your carbohydrates. And psyllium husk, which is the fiber that's in Metamucil, that's one that's really been shown to be effective overall because it really does create this kind of like gel compound and slow, again, the digestion. And psyllium husk has had numerous studies that have shown it can be really effective for controlling your blood sugar, but also your lipids. So it has a good effect on your lowering your triglycerides and lowering your HDL overall. And the way that you can do that is by taking about 5 to 10 grams of this before meals, particularly before you're having, your largest meal of the day. And that should, give you a pretty dramatic improvement overall in controlling your blood sugar control. And it can also increase your satiety. So you may feel like you're full faster. And obviously, if you're going to be eating less overall, you're going to have less of a blood sugar spike. So, a really good way that you can, decrease your overall blood sugar is just by using a little bit of fiber. There are some other options, though, as well, that you can use because the issue with, psyllium husk is that it can also interfere with the absorption of some medications and also supplements as well. But particularly, if you're, taking some really important medications, like hormone replacement medications or blood thinners, these kinds of things that are essentially like a life-saving for some people, you do want to take it like 2 hours away if you can, which can be a little bit inconvenient for some people. So, I do want to mention that and some workarounds for it as well. So there are some other fibers that seem to be fairly efficacious as well. They don't have quite the data as psyllium husk does, but they do have some data indicating that they can be helpful for lowering blood sugar overall and also increasing satiety, but they don't have much of interference overall with medications. So things like acacia fiber or partially hydrolyzed guar gum, these types of fibers seem to have less interference overall on medications and supplements if you do find that kind of 2 hour window to be something that's a little bit annoying or just something that you just can't, avoid altogether. Resistant starch has like a zero effect on any type of medication absorption. So, the potato starch, it's actually more or less like a food than I would say a supplement. that can be really effective. But again, it doesn't have quite the data that psyllium husk does. Psyllium husk has data that even like 10 grams a day can lower your overall mortality by 10%, which is pretty dramatic. That's been shown in, several trials overall and in meta-analysis. So there's really good data on psyllium husk, but again, it can be a little bit annoying because of that 2-hour window that you need to have in not mixing it with your medications and certain supplements. What else can you do to, lower your blood sugar, kind of flatten these big spikes that you can have, besides obviously, not eating too many carbohydrates, and then also, adding fiber to your diet, and particularly eating it before. Well, there are a couple different things. I'm going to go over 2 supplements and then 1 medication. So probably the best glucose flattener that you can use before you eat is something called mulberry leaf. And so what this does is that it inhibits glucosidase and amylase in the small intestine, and that's going to slow the starch or sugar breakdown and delay glucose entry. So what you'll result in is that you're going to have less of a spike in your blood sugar afterwards. And you're going to want to do this about 5 to 10 minutes before you start having, big carb heavy meals. And in the studies, they've used about 10 to 12 milligrams of what's called a DNG, and that's per about 50 grams. So the mulberry leaf, when you're, selecting a supplement that has this, you want to make sure that you look at the DNG content within the mulberry leaf. So if it just says mulberry leaf, maybe it is a good supplement, but maybe it's not, because again, if it doesn't have what's called the DNG listed, you don't really know how much you're getting. And so you want to eat, about 10 to 12 milligrams per 50 carb serving. So if you're going to have, 100 carbs, which is a good bit, then you're going to want to have, 20 to 24 milligrams of DNG before to really get a good effect of flattening the blood sugar spike that comes along. And so I'm just going to talk about the pharmaceutical next, because it's basically has a similar or same mechanism of action as mulberry leaf. And this would be called acarbose. And this is something that some type 2 diabetics use for, again, flattening their blood sugar control when they're going to eat a carb heavy meal. The acarbose is going to be a little bit stronger. So the side effects there are going to be a little bit stronger. You may have a little bit more bloating, a little bit more gas. And this, makes sense because, again, it's not going to be just flushed through your digestive system like it normally is. It's going to be inhibited a little bit because of the inhibition of the glucosidase. So again, they are both glucosidase inhibitors, but mulberry leaf would be a little bit more gentle overall. So you may not get quite the effect that you get from the diabetic drug acarbose, but you are still going to get an effect, and you may have less side effects overall. And then the other supplement that can be helpful for lowering blood sugar before you have meals is apple cider vinegar. And this is something that's really readily available, very, very cheap. And the acetic acid will slow gastric emptying of the stomach. And this can also modestly improve your overall insulin action, and therefore have a little bit of a dampening of that high blood sugar effect that you can get after a meal. So a lot of people will do this, 15 to 20 minutes before they have a meal, or some people even use it during the meal. Some people even like the taste of it, and they'll kind of just sprinkle it on whatever food that they're eating. So there are a few different, hacks that you can use to decrease your elevation in your spikes with using various different supplements and fiber. Fiber, again, some people don't necessarily really consider a supplement as it is, something that is found in foods. But, I would consider something like, Metamucil to be a supplement. It is sold as a supplement. So anyways, that's just kind of semantics. So what are some other ways, though, that you can, improve your blood sugar control and not become insulin resistant? Probably the biggest one, and a lot of people maybe are surprised I didn't mention this one first, would be berberine. So berberine is very similar to metformin. Metformin is a type 2 diabetic drug. Dr. David Sinclair kind of really popularized this maybe 5 to 10 years ago. I think he still takes it himself. He considers this to be basically like an anti-aging drug, and really, considers it to be something that can be helpful for just decreasing anti-aging in general, and that maybe everybody should be taking it. I don't necessarily, agree with that, and obviously there are some, side effects to metformin that, can be, dangerous at times. So, if it is something that you do want to use, it's a prescription anyway, so you're going to have to talk to your doctor about that. But let's talk about berberine, because berberine is something that is available that you can buy online. And it has been shown to lower fasting sugars and to lower hemoglobin A1Cs, like even by up to like 0.5 or 1.0 points. And this is even in like meta-analysis. So it definitely works. The doses used for that, vary between about 500 to about 2 grams a day, which ironically is similar to the doses that we use with metformin in diabetic patients. And so it activates something called AMPK and improves insulin sensitivity. And actually, it can also improve your lipids and decrease inflammation overall. So, it does have quite a few positive effects outside of just blood sugar control. So one of the big concerns with berberine and why some people don't take it is that there's also, a theoretical risk that it can, decrease the amount of muscle that you can put on. But this is just mostly related to when you're actually resistance training. So what a lot of people will do is that on the days of their resistance training, they may still take berberine, but they'll take it, say, 4 to 6 hours away from their workout. And then they'll just use it on their days off or when they're doing cardio. So it doesn't have a negative effect on cardio overall. In fact, it may even have a slightly beneficial effect. There's no, randomized control trial showing that, it improves endurance or anything like that. But because it increases AMPK, theoretically, it may be helpful for the mitochondria and overall for endurance and for cardiovascular fitness. But again, there's, no real good data on that. It's just theoretical, but at least we know that, it doesn't hurt. One thing with berberine, though, is that, it does act, fairly like a drug in some ways, and inhibits some and works with these enzymes that some other drugs work with as well. And so this is something that you definitely, and, I'm not just saying this to protect myself, I'm saying it to protect everybody listening. This is something that you actually definitely want to chat with your, physician about or research about if you are on any medications or even certain supplements, because it does have some interactions that you definitely should be aware of. So, not something just to kind of like add in lightly. That's for sure. But as I said, it definitely has the best and most evidence overall for improving your hemoglobin A1C and improving your blood sugar control. So that's mostly what I have on, some supplements and hacks that can improve your hemoglobin A1C, blood sugar control. There is one I'll just quickly mention. It's called Gymneva Sylvestre. I think I'm saying that right. Some people have said that this is good for sugar craving control in particular. So if you crave a lot of sweets, maybe this is something that you could, add to your diet or in your supplement regimen. The GLP-1s, obviously, those can be incredible for all these things, but I've kind of done a lot of, podcasts on and talking about GLP-1s already. So, if you do have any questions about that, just go back into my podcast. I've done a solo episode on GLP-1s, and, there's so many. When I'm saying GLP-1s, I'm talking about things like Ozempic, tirzepatide. I know the new one now is, retatrutide, that a lot of people are, I guess, using illegally because it's, not prescribed yet. But the things like Ozempic, Mounjaro, Wegovy, those types of things, the GLP-1s, and obviously the Wegovy's have a GLP-1 plus a GIP action. Those can be incredible for, improving your overall insulin sensitivity, lowering your hemoglobin A1C. But again, I've talked ad nauseum about those drugs again. So if you do want to go back and listen to those podcasts on GLP-1s, please go ahead and do that. So what else can we talk about here today? Well, let's just kind of, put it all together for the most part. So what you want to do again is, make sure that you don't have any, large amounts of meals that have a lot of simple sugars. You want to make sure that you have low glycemic index carbohydrates overall. You're going to want to make sure that you're exercising consistently, because exercise is going to make you very, very insulin sensitive. If you want to decrease what we called ages overall, which is, more or less the irreversible product that ages us and that is higher in diabetics and is really associated with just decreasing aging. And something like carnosine can be helpful for that. Adding any kind of antioxidants or having a high, antioxidant diet can be helpful as well. Bentotiamine, again, which is a B vitamin, can be helpful. I didn't mention P5P can also be helpful for ages. And then in terms of, antioxidant buffering, NAC or N-acetylcysteine or alpha lipoic acid can be really helpful. So the NAC, you can use 600. I've seen up to even like 3,000 milligrams a day of that use. The ALA, I've seen doses from like 600 and a little bit below and a little bit up used, but maybe around 600 milligrams a day seems to be sort of the set point or one of the more common doses that's been used and studied overall. So that's basically what I have for you today on insulin resistance and diabetes and how to manage everything overall. And so I hope you guys enjoyed this podcast. If there's anything that I missed or anything else that you wanted me to discuss regarding insulin resistance or diabetes and how to manage it, please let me know, and I'd be happy to come back on and answer your question and do another podcast. So thank you so much again, everyone, for listening. I really do appreciate it. And as always, I'll be back with another episode soon.